Constipation massage is one of the best physiotherapy treatment techniques for overcoming constipation symptoms such as gas and bloating, abdominal or stomach pain, and hard stools. Hi, I'm Michelle, and today I'm guiding you through abdominal constipation massage. Now, this is a proven technique, and we're going to be going through step by step exactly how to do this technique that's recently been shown in a meta-analysis by Jinjin in 23 that's actually established that this technique is the best technique for home remedy for both women and men to use, and these are adult women and men with functional constipation. So what we're going to do is we're going to go through the technique. I'll show you the setup position, and I'll show you the technique in 3 steps so that you can do it at home. And then what we'll do is we'll go through the guidelines, and these are the evidence-based guidelines regarding how often to do this technique, when to do this technique, and basically to how long you'll notice to see a benefit. So let's get started. What we'll do first of all is we'll start with the position and the setup. So I just mentioned too that this technique is suitable for adults with functional constipation to use on yourselves, or also to use on someone else that you might be caring for. Now, functional constipation means that you have difficulty emptying your bowel completely, things like having hard stools regularly over the last 3 months, and also too for a 6-month period, and also to feel like you're not emptying your bowel completely and you're moving your bowel less than 3 times a week. So there's some of the symptoms, and you need to have at least 2 of those to be diagnosed with functional constipation. So let's get into this great abdominal constipation massage technique now. Now, the basic setup for constipation massage using this abdominal physiotherapy technique involves lying down. So ideally, you should be lying down at 30 degrees. So a good way of getting into position is this way. So I like to use 2 pillows. And if you cross the pillows over like this, then you're actually going to make a bit of a wedge. And then you can use the 3rd pillow on top. So that's going to give you something to recline on. You could also use a recliner chair at home if you want to. Or you can even just lie on the ground. When I use this technique myself, I often just lie flat on the ground with my knees bent. And it's also nice to have a cushion or a pillow for underneath your legs so that you can lie back and relax with your legs bent. So let's get into the technique now. We'll go through the basic steps so that you understand exactly how to do this on yourself to relieve constipation at home. So if we think about the bowel, the large bowel travels from here on the right side up, underneath the rib cage and down. So this is the area that we're working on to try to move the stool through and down to the rectum to be emptied. So this is how we do the massage, and I'm going to show you in this sitting position. You're obviously doing it lying down. So you start with your hands, a heel of your right hand on your right pelvic bone, just in there. And what you do is you press in just gently. So this is just a very gentle movement, this first one. And while you're relaxing your belly, slide your hand up, pressing in just gently till you feel the rib cage. Then slide it across clockwise to your left, and then slide the hand down and down until you meet the hip bone. Okay, we're going to repeat that a number of times. And this is how you actually start this process of moving the stool through the bowel and stimulating the bowel movement. So the second time that you do this, you can put your hand there and you can place the heel of the other hand on top to apply a little bit more pressure. So again, you're moving from your right side, your right hip bone, pressing in just gently, not too firmly, just a gentle pressure. See if you can breathe out and relax your belly as you come up to your rib cage, and then slide your hands across underneath your rib cage, slowly relaxing the belly, breathing out, and then guiding down and down to the hip bone. So that's your first technique. And you can do that a number of times. And you're likely to start to feel some gurgling and some movement in your tummy. I often do when I start this technique. When you're actually starting to shift the stool or the fecal matter through your large bowel. Now, this is the second step. The second step, we actually start on the left side, and we're going to make circular motions with our fingers. And what you do is you start under the rib cage on the left side here, And you can just use the pads of your fingers on each other. You can use one hand if you like to, or both hands.
And you just apply gentle pressure as you do small circular motions, and you're gradually moving down towards that left hip bone. And you'll often find that you might, or I often feel, like hard areas. And they're the areas I tend to just work on a little bit more, because I sort of visualise that that's a hard area of fecal matter or stool that I'm just massaging and softening to help empty. So it's really important that you start on this left side first, because we're going to clear some space here and soften the stool on this side first, so that then we can start to shift it across. So then down to that hip bone. Now, once you've got down there, relaxing your breathing, and you can take your time with this. There's really no rush at all. As much time as you want to use. And then you lift your hands and you come onto the right side here. So we're going to do the same thing on the right side. And again, it's those small circular motions, just pressing in gently but firmly at the same time. So I'm probably pressing in about that far. So just so I can feel what's happening. And then again, just noticing what's happening in your belly. You shouldn't feel any discomfort with this. It should feel comfortable throughout. If you feel discomfort, obviously you stop. And then just working up. And you're working up till you get to that rib cage again. Now, once you get to the rib cage, slide in with the heel of your hands, slide your hand across and in, and then your circular motions back down and moving down towards that left hip. Once you reach the left hip, come back to the right side, and you can do some circular motions back up and repeat that. And you can repeat that as many times as you choose to, up to 4 to 5 times in a row perhaps, just taking your time with that. Now, the final step, and this is the third and final step, is to actually then repeat our what's called effleurage, our deep sliding movements. And we're going to start again going in our clockwise direction, starting on the right side of the hip. This is where I really do use heel of my hand and the heel of the other hand on top. And breathe out, relax your belly as you slide up, and then really move the stool across, stimulate that bowel, and then slide down. And this time when you slide down, when you meet the hip bone, you can slide off and inwards to your rectum. And your rectum sits just behind your bladder down here. So you can really be guiding the stool down in that direction. So again, we're going to be repeating that, and I'll go through the guidelines of how often to do this and when to do this in just a moment. So you can repeat that as many times as you like. Then what you'll actually do at the end of that is you repeat some deep breaths. And again, so you can do those now if you like to with me. Again, slowly and deeply breathing in through the nose, let the belly expand, and then straw breathing out through the mouth and allowing the belly to sink back down again. Now, having done that, I suggest you get up. If you can, have a warm drink, because a warm drink is a great stimulant for the bowels. And to move, you can do some constipation exercises. You can see those in the video that I've got above. Or also, too, you could go for a short walk. Something to actually stimulate movement, stimulate the bowel movement. And often you'll find your bowel empties fairly soon. You'll pass gas and your bowel will empty within the next 15 to 30 minutes. That's my experience using this technique, and I use it frequently. So the guidelines, these are the specific guidelines now, the 2021 guidelines that have been released. These are the evidence-based guidelines, and again, these are linked below if you'd like to read them. This is level A, grade 1 level A evidence, so very good evidence supporting the use of this technique for overcoming constipation. These are the guidelines that I'm giving you. Also, too, using the technique 5 to 7 days of the week. And again, you can use it as often as you like to, really, over a period of 4 weeks as a suggested minimum. And that's based on the studies. I frequently find that I can just use it for a day or 2 days and it works pretty well immediately. So while you're actually constipated, it can be really useful to be doing this technique regularly during the day. The guidelines specify doing this exercise, this constipation massage, for 30 to 60 minutes immediately after a meal. So within that 30 to 60 minute time frame, and that must be a time when we have enhanced gastric motility. So that perhaps is the reason for that particular guideline. So those are the recommendations. always should be pain-free, always should feel comfortable. So I really look forward to hearing from you as to how this technique goes at home. Try it yourself. I forgot to mention to warm up your hands too before you do it, because it's nice to have warm hands when you're actually doing some soft tissue massage on your belly. So let me know how you go in the comments below. I'd love to hear. And then if you really need to empty your bowel without straining and avoid straining with constipation, coming up next is my Moo to Poo video, which teaches you how to empty your bowels safely without straining. So be sure to catch that next. So thanks so much for watching today. I really hope that this video on constipation massage is helpful for you. And remember that the research guidelines are listed below too if you'd like to have a look at those too. Thanks for watching today. Look forward to seeing you next time. Goodbye for now.